Hi, my name is Dr. Schnorr, and I'm one of the reproductive endocrinologists at Coastal Fertility Specialist. I'm excited to be here with you today. I have the pleasure to be one of the founders of Coastal Fertility Specialist, but also the medical director of Coastal Fertility Specialist and the division director of reproductive endocrinology at the Medical University of South Carolina. My passion for reproductive endocrinology started when I was an OB/GYN resident at the University of Virginia, that was in Charlottesville, Virginia. At that time, I was newly married and we didn't have any children at the time. We had a little bit of difficulty getting pregnant when we actually needed medical treatment to get pregnant, and now we have a family of 2 daughters who are the center of my life and the light of my life. I've been married now for over 30 years, and when I reflect back on who I am and how I became who I am, I realize that it started in my early educational years, medical student, residency, and fellowship years. During my OB/GYN training at the University of Virginia, I met some amazing people who really made sentinel contributions to the field and to the world, and I always wanted to be one of those people. I met a neonatologist who's a doctor dealing with infants who couldn't understand why when babies were born premature that they flared their noses and they grunted. He came to understand that they were creating positive pressure in their airways, keeping their airways open so they could breathe, and he invented CPAP, which is an everyday treatment nowadays for patients with sleep apnea and other airway disorders. I also met one of the doctors who actually discovered GnRH, which is a hormone secreted out of the hypothalamus that allows the reproductive system to work. He understood and did research into pulsatility of that, which is foundational for what we do right now in reproductive endocrinology treatment. Through my time with those leaders and experts, I was able to get into what at that time was the best reproductive endocrinology fellowship in the nation. It was called the Jones Institute for Reproductive Medicine in Norfolk, Virginia, a place that was started by Howard and Georgiana Jones, who were both physicians. One was an OB/GYN and one was an endocrinologist, and they started the Jones Institute for Reproductive Medicine, and as a result of that effort, had the first IVF baby born in the world from the use of injectable medications. That was a time in which IVF was new, technology was low. They literally thought that eggs needed to be retrieved at night because people only had intercourse at night. They believed that the egg retrieval needed to be done in an operating room, which was at body temperature, because they felt the eggs and embryos always needed to be at body temperature. There was a time in which pregnancy rates were 7 to 8% per IVF cycle, and at that time they were transferring 5 or 6 embryos into the uterus because the egg quality was low, the embryo quality was low. It had to do with medications and retrieval techniques and incubators that just weren't up to what they needed to be. But what Dr. Howard and Dr. Georgiana is they were persistent. They were always investigating how to make things better, and they were always pursuing efforts that made the world a better place. And that really resonated with me. That's who I was, and that's who I wanted to be. And so through that training, I learned a lot about reproductive endocrinology. I came to Charleston, South Carolina in 2001. I joined a practice at that time and later formed my own practice in 2012 called Coastal Fertility Specialist. At Coastal Fertility Specialist, we actually believe in a centralized laboratory system. That's a system in which we have one laboratory that we focus all of our time and effort into developing it so it can be the best that it can be. That allows us to maximize financial resources so that we get the incubators we need and the equipment we need to maximize your pregnancy rate. But it also gives us the ability to focus all of our attention and intellectual effort into one laboratory so that we can make sure it's working at top performance when you're coming through for treatment. We've developed regional offices, which are offices further away that are closer to where you live often, so that 95% of your visits can be done in your local hometown, where you can then achieve those highest pregnancy rates through then coming to the Charleston office for your egg retrieval if you needed in vitro fertilization. We also do a lot of simpler fertility treatment, whether that being testing or treatment like IUI, which we can be done in your regional offices without ever needing to leave your local area. We believe that we need a good team around us to support this effort, and we hire registered nurses who will be your one-on-one nursing coordinator who will lead you through the infertility evaluation and treatment process. We have some great physicians we work with that also help to collaborate along the way, and through that effort have achieved pregnancy rates that are amongst the top in the nation. I encourage you to go to www.sart.org so you can see what our pregnancy rates are, and if you're interested, you can see what other centers' pregnancy rates are. Our pregnancy rates didn't happen by accident. They happened by always making decisions that are best for the patient. And so whenever we're making decisions, we envision a patient being in the room with us to help vote on a decision moving forward to make sure we're making the best decisions for you. On a personal note, I live in Charleston, South Carolina. I've been married now for 30 years. My wife's name is Susan. I adore her. I have two wonderful children. One is 24 years of age. Her name is Courtney. Courtney is now a PA student at the Medical University of South Carolina and interested in going into the field of dermatology, which is good for me because it's the thing I know the least about. So she can help me understand what these different lumps and bumps mean and how to treat them. My oldest daughter is Jessica. Jessica is actually an OB/GYN resident. She's at Parkland Hospital, which is one of the largest obstetrical hospitals in the United States. She's been a very busy girl over her time being at Parkland. She's seeing a lot. She's doing a lot. And she, at this time, I think, is interested in general OB/GYN and maybe even high-risk obstetrics. So we'll have to see how that shapes up. I enjoyed spending time with you today. I look forward to meeting you. If you have any questions, if you have concerns about your care, if you have suggestions about how we can improve your care, we're all about becoming a better place and look forward to your feedback. I look forward to seeing you soon. Take care. Bye-bye.